Got ladies first. Sure.
No, she's
I was the last in line at the last time we came here. So, anyway, my name is Jim Yacobo from Shelton. I'm here with my wife. Thank God, my wife and I just got on Medicare. We beat the Obamacare nightmare. We were starting to see our premiums go up. And I guess my question is, you hear all of these stories about why we had to have affordable care. There were 47 million people uninsured. Is that a fair number of people thrown around before the act? 47 million people. So far, 6 million people have lost their insurance. 5 million people have signed up. That's a net loss of 1 million. That means there's still 47 million people. Where's the demand for this Obamacare? The 47 million people that were uninsured, you know, that we were told, oh, there's people dying out there, they can't afford insurance, they this, that. Why aren't they signing up? It's either free, subsidized, or available. Nobody wants it. But my point is, the free market is telling us there are 47 million people without health care, and most of them don't want it. For whatever reason. They don't care. They figure they're, you know, the invincibles. And it's just, so my point is, if there was such a tremendous demand, we were told we have destroyed our health care system for this stupid act. People's premiums are going up. Their deductibles are skyrocketing. I know people whose premiums have gone up 20, 30, 40%. For what? He's changed the act 35 times now. He's trying to get by the election so he can get reelected, for example. That's that point. Now, number two is the deficit will never be paid off. We have 17 trillion plus. You do the math. You took out a 30-year mortgage on our deficit. We've all had mortgages, right? 30 years. To truly pay it off, 30-year mortgage at 4.5% would cost us $30 trillion. And it'd be paid off, and at the end of the 30 years, we'd have another 20 trillion in deficits. So it's anybody who says we're going to pay off the deficit is dreaming. It's not going to happen. That's all. They can comment or not, but as you can tell, I'm not terribly happy.
Okay.
But I did escape Obamacare.
Okay. Well, I am glad you got on Medicare. Medicare is obviously a good program that actually provides coverage to about 50 million Americans.
I didn't have a choice. You have to. If you don't join it, they punish you. So.
Yeah. So let me say two things quickly. First of all, there's about 15 million people who are newly insured under the Affordable Care Act. There's about 5 million people who have signed up. There's about another 6 million-ish people who, because of the ACA, they were between the ages of 21 and 26. They can go on their parents' plan, about 5 or 6 million. And then there's about another 4 or 5 million who signed up for extended Medicaid. So the number of people actually who didn't have insurance before in this country who now do is getting close to 15 million.
Yeah, but you can have Medicaid without Obamacare.
Well, remember, Obamacare was what extended Medicaid to a lot more people. So yeah, you could have just done that. But again, look, I'm not here to tell you that the act was perfect, but I will get the facts right. And you're right. You know, key to this. And by the way, this is the whole ballgame: is whether the young people sign up. And young people have been signing up, but probably not fast enough as they need to. And you know, a year from now, we'll get back together and we'll see if it worked because young people signed up. Now, on the premiums going up, premiums have been going up a lot since well before Obamacare was even an idea in anybody's mind. So we've got to at least separate what cost comes as a result of the Affordable Care Act and what has always been happening. So I don't want to, we'll talk more about healthcare tonight, but as I said before, the fact that you can't be turned away with pre-existing conditions, the fact that some, not enough, but some cost reduction mechanisms were put in place, the fact that there are some 15 million Americans. By the way, the number here in the state of Connecticut is about 180,000 people newly covered. That's good stuff. You're right. If the cost side doesn't keep coming down, this thing doesn't work. So, and the jury's out on that. There's some initially good data, but the jury's still out on that. And you're right that some people who lost their plans, as I said earlier, that was a very difficult experience for those people. So I'm not quite as pessimistic as you are on that point, but you know, a year from now we'll have a better sense of where we are. But thank you for your comments. I'm glad Medicare sort of took this issue off the table for you and your wife.